Hey, Happy New Year, everyone. And as people get settled down, welcome to the January meeting of the Ealing's Health and Wellbeing Board. Um, Usual welcomes to everyone. And if you could introduce yourselves. Happy New Year, everyone. And as people get settled down, welcome to the apologies for the sound issues there. I think we have solved it, hopefully, or I will hear myself again in 90 seconds. If you could introduce yourselves as you first speak. We particularly welcome Gurpreet this evening from EHCVS, who we hope will be joining us formally and officially in the not too distant future once we've sorted out some governance issues with the council's constitution. But you are most welcome. We have apologies from Councillor Nagpal, and I think from Carleen Duffy as well. Oh no, Carleen is online, I can see. Wonderful. So we have Carleen, which is excellent. I don't have any other apologies, I don't think. There are no urgent matters. Are there any declarations of interest anyone wishes to make or needs to make? No, wonderful. No matters to be considered in private. So can we turn to the minutes of the meeting in November, I want to say? And were there any corrections to be made to those from anyone? No. Shakes of the head. Wonderful. I shall take those as an accurate record then. And then we move on to item number 6, Health Watch update. And Carleen, you have a verbal update for us.
Yes, good evening, everyone. Happy New Year. I will start with our interim views. So, as I mentioned at the previous Health and Wellbeing Board, we are conducting our interim views in care homes. So, we've completed 4 in care homes that are rated as good and 3 that have required improvement. We are completing our final one on Tuesday, the 16th of January, for one that requires improvement. And then we will be providing an overarching strategy for care homes on how they can collectively improve. We're hoping that this can go on to be used as background research into a project we're considering in the future, living well at home for longer, which fits within some of the adult social care work at the council, such as the dementia strategy and homebound exercises and the carer strategy and digital exclusion for the elderly. Um, we have also been chosen by Healthwatch England uh, to look at the community diagnostic centre that's um, about to open in April in Ealing. So we're looking to set up the date to visit in the week of the 29th of January. So we really appreciate the cooperation and the support of the London Northwest University Trust as they're implementing the new facilities and going through a phased opening until the spring. So it gives us this opportunity to provide real-time feedback while they're introducing this new area of service. And we aim to do another one of these in 6 months when the site is fully functional. The most reported activity at the moment is around MRIs, so this will be the focus of the visit. In terms of projects that we're doing, we are doing a maternity project that's a focus group of case studies capturing the maternity experiences of vulnerable asylum seekers and refugee women. Thus far, we've done 2 focus groups and have received 21 responses. We are also doing a vaccine project that is an engagement project capturing the attitudes of young people and how COVID has changed their views towards vaccinations. And we're including a snapshot of how this compares to the general population in Ealing. So thus far, we have collected 158 responses from the general public. And we are starting to go to schools now to talk to children in specific around the HPV vaccinations. We have also been continued to develop our patient experience program. So in Q2, we collected 1,327 responses. There was a slight decrease in positive experiences due to, especially in hospitals, due to workforce strikes and winter pressures. But quality of health professionals and attitudes and the quality of treatment and the communication of patients still remains high. And that is the majority of the work that we have done over the last 2 months.
Great, thank you very much. And I think we're looking forward to the results of that vaccination work in particular, I think, which we discussed last time. I think we were going to discuss, I think, possibly offline with public health colleagues on and some of the work they've been doing previously. So that's fantastic. Are there any questions or comments for Carleen and the Health Watch update? I can't see any. Thank you very much, Carleen.
Thank you.
Which brings us on to, I think, Arla is going to present Anna on the Health and Wellbeing Board Action Plan update.
Hi everyone, I'll just introduce myself because I'm new to the team. I'm Ala Jawad and I've joined Anna's team recently as a consultant in public health. I'll upload the slides and I'll let Anna make a start.
All right, thanks everybody. So for those who have not met, I'm Anna Bryden, Director of Public Health at the Council. So Arla's going to run through these and it's just loading them up. Hopefully the IT works. Just wanted to bring back here, we are going to get into a cycle of doing annual updates through the 5 years on the health and wellbeing strategy. But given it's the first year, we felt it was quite a long time to wait. So this is our kind of interim halfway through the year update on where we are. So you'll see in the attachments, there's a couple of different things. The slides, we're just going to work through the summary in a minute. We have been going through the line by line action plan and updating that, so that's included. But alongside that, we've been doing something that feels really, really helpful and really positive, which is bringing together a load of case studies from across all of our health and wellbeing partners in terms of where people have aligned their work and are taking forward the health and wellbeing strategy in their own way, which is fantastic. So there's really, really rich case studies in there, and we'll talk through some of those and talk through the impacts that we're starting to see for our residents in their daily lives, and also some of the kind of more process infrastructure actions that are being taken forward that are really setting us up well to take forward the rest of the strategy. So Arla, that's showing up. Do you want to take us through then those key impact slides?
We can't hear you, Arla. I can't see you to know whether you're muted or not, but
Can you hear me now?
yes, perfect.
And you can still see the slides, I hope.
Yes.
Just making them full screen now. Thanks very much for that, Anna. So just to take you through, I'm sure a lot of you are very familiar with the health and wellbeing strategy, but just to refresh all of our memories. So the Together in Healing strategy had 3 main themes. The first was putting communities at the heart of everything. And this is really about having that new relationship with communities rooted in a deeper understanding of their lives and driving a culture to change our working to work together in a stronger partnership. The second theme was around the systems and structures to leave no one behind, particularly thinking about a culture of fairness and justice. And finally, the third theme was around connecting the building blocks of health and well-being and having a shared practice across the board and joining up our work and doing so. So as Anna mentioned, we had a great response when we were thinking about what work has been done so far and what have we set up in the initial few months of the strategy to allow us to achieve the changes we want to achieve. And there's particular groups I wanted to pull out from sort of bringing this together, particularly around work that was done with children and families, specific resources for care leavers, for elderly residents, around the cost of living specifically, having an inclusive Ealing and improving specific services. And I won't go into too much detail here because I have a few examples I really wanted to pull out. So thinking about how does this directly benefit our communities? We had over 4,000 residents attending a 4th prevention session, proactive calling of elderly residents to identify eligibility for support, receiving and circulating an adult services newsletter, having specific care events. So, for example, for diabetes care, really integrating ethnic minority BAME groups within the council's work with 34 new groups created under Tagapri supervision and the new initiative. chai and chat sessions with over 200 South Asian women. 153 asylum seekers had health screening that was taken to them rather than them having to seek out health at multiple different sites. There's a current pilot for high intensity healthcare users thinking about a more integrated approach to their health. And we had, over 560 students contributing to town forum planning, families with face-to-face sessions to support them in school readiness, and over 2,300 pupils reached through the therapeutic thinking training being done in our schools, and 102 children and families pledging to be sugar smart. And the real focus of the first 6 months has been, as I mentioned, setting up the structures to enable us to really get the health and wellbeing strategy implemented to the best of our ability. And I'll start at the top here, really thinking about our capacity building. So I hope all of you have heard our very happy news that the Health Determinant and Research Collaboration have approved us for this £5 million grant, thinking about building and research and capacity within the council. And that'll massively give us the boost we need to continue to implement the strategy as well. My current role as a public health consultant, providing leadership for the implementation of the strategy over the next 2 years, hopefully, and then thinking about how we've changed the way we've funded community services through the voluntary sector. Thinking about the infrastructure, so particularly the council policy and strategy review will enable us to have multiple opportunities to input and have a more health and wellbeing focus, as well as a review of the membership of this board in the new year as we progress into it, and partnership board structure more widely within the council. We've already got some examples of really fantastic work around co-design and really lending the health and wellbeing lens to that around the community charter, multi-faith forum and town forum. And finally, we're already seeing some digital tools being specifically created to make sure all the needs are met. The key one I think I wanted to mention was the inequalities data platform that we're in the process of creating, hoping to build all that information into one place and make it more accessible. I wanted to pull out for each of the commitments within each theme a few examples of work that's currently being done. I won't give you too much detail. These slides have been circulated and happy to answer any questions if there was a specific piece of work people wanted to hear more about. But thinking about how the health and wellbeing strategy embeds listening to our communities, we had the really successful suicide prevention and self-harm action plan that was co-designed with residents. The Community Design Centre both provides training as well as allowing residents to have a voice within that, and targeted support for the BAME voluntary sector groups that I mentioned before to enable them to get the access and access the funding that they need. Thinking about some of the structures and how we've tried to change them, I mentioned the High Intensity Users Project and how we're supporting them, the Ealing for Everyone pledge to make us more inclusive, and finally the Partnership Board structure review. And finally, connecting that building blocks of health and well-being. So the cost of living has been something all of our residents have suffered with greatly, and actually having that targeted financial support for that, thinking more about strategy and policy across the council and the community of practice that's being created as a result, and taking a more holistic approach. So, for example, for children's health and well-being, there's quite a structured review that's being undertaken to provide that approach. And then I'll just hand back to Anna to talk through our short-term plans.
Thank you, Ola, for taking us through that. So I think you can see there's some fabulous examples, a really broad range from lots and lots of different organisations and teams, and lots of work jointly with residents on there, which I think is great. And I think we can really see the spirit of the strategy is being embedded. We had so many examples where we got, say, strategies from, say, other council teams where they listed things they'd aligned it with, including health and wellbeing strategy, which is fantastic to see it really getting embedded in everyone's work. And obviously that's a work in progress, but really good start for everyone. So just to say, we're now working on working with communities and lots of organisations and partners around what's the action plan look like for year 2. Might do it in a bit of a different way. A bit more accessible, hopefully a little bit more engagement with communities on that. And then we'll be coming back in September, which was the anniversary of the action plan, with a more formalised report against the actions and see how they're being taken forward and set the action plan for year 2. So I think that's all. There's our contact details there if anybody's got any questions or wants to get in touch. We're trying to work out a way to gather case studies as we go. So it's not just annually and actually park them somewhere so people can see them and build them up over time. But yeah, just wanted to leave it there. But yeah, big thank you to everybody for their input on that and for replying to our lovely emails, chasing everybody. But I think there's some great examples. Thank you.
Great, thank you. And particularly not only council examples as well, which is probably the most important thing, because this is not just a council strategy. It's one owned by the Health and Wellbeing Board, which is not just the council. It's our NHS partners and community partners as well, which is why Gurpreet is here, even if informally for now. Are there any questions from anyone to Anna or Arla, or comments on progress so far? Kerry.
Thank you, Chair. I'd just like to comment on one area of work that's been led and driven through the Health and Wellbeing Board strategy in terms of the Suicide Prevention and Self-Harm Action Plan, and to really recognise the excellent work that's been done within public health to turn this from a data-driven exercise, looking at people who've completed suicide and healing, using the information to reach out to the various communities that they come from, and then engage with those communities to develop action plans to prevent people causing future harm to themselves. I think it's really flipped our approach in terms of our understanding and engagement within the community with regard to such challenging issues such as suicide prevention. I just really wanted to highlight that because I think it's a really strong example of where the health and wellbeing strategies influenced our activities.
Great, thank you. I don't see any other. Simon.
Yes, so well done, I would say, and thank you for sharing. As you know, we presented the London Northwest strategy probably about this time, probably about March, April time last year. We're in the process of doing a similar exercise, so it's good to see the work that you've done in terms of looking at the actions that we had agreed and the progress that we had made, and clearly I'd be happy to give a high level overview of those at some time in the future. We haven't done the work yet, but I'm happy to do it in due course. But the question really was for Anna and Arla. So there's lots of good examples. Is there anything in there that hasn't progressed as you would like? And is there anything any other partners can do to help in terms of progressing any of those things that haven't progressed in the way that you might have anticipated or liked?
Thanks, Simon. I'll try that, and then I'll obviously jump in as well. I think it's not so much things haven't progressed. I think there are some things on there that are slower. So, for example, especially in theme 3, which is the building blocks of health, there's a lot in there about really shifting how we see things, especially from a council point of view, thinking about looking at those building blocks of health, so housing, education, employment, with that wellbeing and inequalities lens. There's loads of good examples of that, but it's really pushing it forward. And I think there's work there. They're complicated long-term issues, and they're going to carry on being complicated long-term issues. I think, for example, we've got the Homeless Health Board, which has just started the last 2-3 months. So things are starting, but they will be slower items, and that's reflected in the action plan. They're not year 1 items, they're year 1 to 3. So I think they're the main ones for me. Arla, did you spot any going through that you wanted to highlight?
I think it was maybe didn't progress as expected, but I think sort of the action plan's being implemented with some work that was ongoing that has now got a health and wellbeing lens sort of applied to it. But as we move forward, what we'd like to see more of is that the strategy underlies it. It's sort of that's what pins it down, and then it progresses from there. So it's that sort of shift in how the work comes about and how it progresses that I'm hoping to see more of over time.
Thank you. That's helpful.
And I suppose the second part of Simon's question, which was, is there anything any other partners can do more to help just push some of those, maybe kind of those early year 2 commitments through, that we need to start working on at the moment?
I can't think of any specifically, Simon, but I think it's really thinking about those more complex ones across partnership. I think there's partners are great at working together one-on-one. I think it's where we need 7 different people in a room and 7 different organizations. I think that's the ones where it's just taking that commitment, build up those relationships, build up those discussions, have those honest conversations, and really everyone just willing to be in those rooms, which it feels like we are.
Great. VJ.
And it's really excellent news in terms of hearing about the Health Determinants Research Collaboration Award that Ealing Council are leading on. And a note from the presentation, there are a number of other partners in collaboration working at Ealing Council, my question is really around the coordination of this, because it's quite a challenge, in terms of when you've got multiple partners working collectively in this way in terms of trying to develop research like this. I just want to have a little bit of understanding of how that coordination is going to work, and in terms of looking at evaluation and progress of this 5-year program.
Thanks, Vijay. That's actually our next item on the board. So if you're happy, can we come back to that question if it's not answered? Is that okay? Thanks, Vijay.
And then Councillor Mahfouz.
Thanks, Chair, and thank you to Anna and Alara for the presentation. Very comprehensive achievements in the past 6 months, which is fantastic. And I wanted to ask really about sort of risks to delivery going forward, and identified obviously a couple of key areas there around support for asylum seekers and health screening there. We know obviously homelessness is on the rise at the moment as well. So just wondered if there's any challenges sort of from a national policy perspective, which is going to potentially impact in terms of our ability to deliver against the strategic objectives within this.
Thank you. I'll start answering that, Councillor Mahfouz, but others might want to comment on challenges. I think a lot of it is the same for all strategic work. It's everybody having the time and headspace and capacity to get around the table to have some of these harder conversations and commit to that in the long term. And there's an awful lot in the strategy that isn't, things to happen next week. It's things to really be kicked off over the next couple of years, and that takes time and commitment. And I think where you have got financial issues across all public sector organisations and CVS and communities, everybody's struggling, increasing costs, etc. I think that becomes harder. We are working, Neo and I especially work very hard to find lots and lots of pots of money and really think about where can we use non-recurrent funding to help us with some of this long-term stuff and really use it wisely and carefully. I think a big part of it is working with great partners like Gurpreet and our community colleagues, and really thinking how can we get those relationships better? How can we build up our communities to do this with us? So it's not just the public sector's off doing nice things and not talking to anybody, which obviously isn't the case, but really, really building that up and really thinking about it. So where we are, one of the examples in there was us funding from our public health money, actually funding a new network for smaller VCS groups who are working with smaller communities, not necessarily set up, not necessarily working together. And that to me feels like a fabulous use of non-recurrent money over a couple of years, and actually something that will leave us with a lasting legacy. So I think it's picking those actions that will really set us up well for the future in a big, difficult context.
Thank you. And if I can just add to that, I think there are some challenges which I think affect everybody, like the homeless board that we've set up. It is doing exactly what Anna was describing, bringing all of the different partners involved from the community, from health, from local authority, from all parts of the sector together. But just pulling that together, keeping a shared aligned vision going, and trying not to boil the ocean and do the things that are going to make the biggest difference in the shortest period of time, showing that this type of model works, and then moving on to the next big thing that we can tackle together takes a lot of work and trust building and time to do some of the things. So I think some of the ambitions in here are absolutely the ones that we're all committed to, but some of them will take longer than others, and the demands just keep on increasing, and the pressures in the system keep on increasing. And everybody is just trying to run to stand still to keep up with the immediate pressures going on. And it's the same people usually doing this type of long-term thinking and coordination and work, as well as trying to do all of the other stuff. So I think that capacity to do that and have faith that, okay, this might take longer, but we will see outcomes out of it, it is going to be an important one as part of this strategy, I think.
Right, thanks both. Joe.
Sorry, hi, I'm Jo Manley. I'm here from West London Trust. And I guess it's a question through you, Chair, to Neha about perhaps some concern that with some of the proposed changes in the ICB structure that we are going to practically lose capacity for some of this work. And do we need to be flagging that as a risk?
It's a very good question, Neha. Would you like to try and tackle it?
Yeah, it is a real risk, to be honest. The ICB is very committed as part of the ICS strategy as well, on the inequalities agenda and our health and wellbeing strategy and our borough-based partnership working in particular. But the reality of it is that we are having to make a significant saving in our workforce, which equates to between 30 and 40% of our local team. And we do need to think outside of the box around how we don't lose the focus and the momentum that we've already had with progressing some of these schemes. And I would like that question asked to me very regularly, so that it remains one of those priorities for us as well, with whatever staff and team is left.
I think I should add, Councillor Mason and I did respond to the consultation on that with the council's point of view, which I'm very happy to say is that obviously we recognise that funding is becoming less, but that we feel that Ealing's share is possibly, given some of the contextual information around inequalities, particularly, that it could be better managed locally. But I think that's currently with the ICB. Kerry and Anna both wanted to jump in. I don't know who wanted to come in first.
Thank you, Chair. Just to say the importance of capacity and resource within the local system in Ealing, we know has been highly effective over the many years that we worked in partnership with colleagues within the NHS, that the proposals disproportionately impact on Ealing as a borough, as a system. And I know that's something yourself and Councillor Mason raised, Chair, in your letter to the ICB, and it's also something we've raised within the scrutiny committee as a concern. So there's a lot of concern within the system about this.
Thanks, Chair. I think just a tiny add-on point with a bit of hope. I think money is obviously not everything, but it does help. And a lot of the funding that we're using to take this forward in a transformation way is actually NHS funding. And it's fantastic that I think ICB is really committing to that through resources, not just a kind of something nice on a piece of paper. So we are really using that carefully locally and really working together as partners to spend that as well as we can. And I think it really does show that long-term commitment.
Great, thank you. Probably a good point then, if we're talking about money and the future, to segue on to item number 8, which we've mentioned a couple of times, and I'm going to try and get the name right. The NIHR HDRC Ealing, the NIHR Health Determinants Research Collaboration, and I think I saw Vaish has joined us. Fantastic, to take us through the very positive news that we've already heard a couple of times this evening, but just to formally update everyone. Vaish.
Hi everyone. Can you all hear me? Great. Hi, I'm Vaish. For those of you who don't know, consultant in public health. I'm really delighted to be taking you through this item. I think most of you are aware of the good news that Ealing were successful for funding for the NIHR Health Determinants Research Collaboration bid that we put in. So I'll just, Sam, I can't see the screen, so I don't know if you've got the slides up yet, but thumbs up if that's all projecting okay.
I'm not sure we've got them this end.
No. Is Sam around? Sam Kirkham? I think he said he'd yeah.
Yeah, I don't think we've got a copy to load up.
Oh, okay. You got the slide pack. That's fine. Slide pack's fine. If
I think Anna's able to. No.
Don't worry. Have you got the slide pack? It's in there.
We do all have them, so I think take us through them. And
Sure.
They are available on the meeting agenda page of the website as well. So
yeah,
people want to first than they can.
Yes. Sorry, I'm having tech issues. So just to share. Oh, it has started screen sharing. Brilliant. Thanks, Sam. So for background context, the National Institute for Health and Care Research, it's a big health research funder, has traditionally funded more health service, biomedical kind of focused research, and it's really emerging public health research program post-COVID, really thinking about health inequalities and local government as a key site for tackling health inequalities. So the the programme was launched over a year ago with the Wave 1 Health Determinants Research Collaborations, and Wave 2 was launched last year now, and we were applying in Wave 2. So we were following the first cohort of 13 successful HDRCs. We've been successful following the process last year, which was a very rigorous and competitive process. 11 local authorities are starting January this year to become health determinants research collaboration authorities, with 6 more coming on board after the development year. So there'll be 30 in total across the UK. Sorry, Sam, we're still on the first slide. And 4 now in London. So we are the only successful one in London this round, and we're joining Tower Hamlets, Lambeth and Islington, who were successful in the first round, alongside all the other authorities all across the country, from Scotland, Wales, and down to, I think, Cornwall. Next slide, please. So the Health Determinants Research Collaboration is really to develop our research capacity to do research to tackle health equity. It's also to develop a collaboration with academics in universities, as well as we in our bid, we were very keen to involve community participants as co-creators of this vision. So that as the sort of slide shows, it's a partnership between the council, 3 higher education institutes, the Institute of Development Studies, which are part of University of Sussex, Imperial College London and LSHTM, and we all have existing links with these organisations, and they have been brought in for their specific skill sets in different parts of the bid. We're also working with our local partners, Ealing Hounslow CVS. I think Gurpreet's with us today, could add some, I'll bring you in, Gurpreet, in a moment, GOSAD and Southall Community Alliance. Next slide. So the overarching aim is to transform our research system and infrastructure, so to strengthen and grow our research collaborations. And they're really big on the ability to drive organisational capacity building and culture change, so that the council is really using the best research evidence available and also creating new research evidence locally as well to expand the evidence base around health equity research. And we're essential to this. We want to ensure that we embed diverse and inclusive community involvement in this research transformation process. I'm not going to go through all the objectives. You have that there, but just to say, I guess, when we just overheard the previous conversation, challenging financial context, etc. This feels like almost a bit of a luxury that the Department of Health are funding this programme, which is explicitly around capacity building, recognising there's no quick fixes for some of these complex, entrenched social problems that we want to tackle. And they're really giving, they recognise that the HDRCs are almost a bit of an experiment. I think we've been given some assurance that there's some freedom that they will give in terms of the performance monitoring. They really want to see what happens and to make them work. So that's all quite exciting. So the detailed research plan is extremely detailed. We had to do something quite thorough to get the bid, but I'm just going to highlight some of the elements. So we've divided our work activities into work streams. That includes setting up all the infrastructure, so the boards, the governance, the partnership agreements, or the legal contracts with the universities in work stream 1. The 3 sort of core work streams, I would say, is around sort of developing our research and data integration. So there's one strand around developing a action research infrastructure with IDS, working with communities to lead and co-create the research. So action research is a methodology which involves getting insights from the diverse people that are part of the inquiry process, and testing out tangible actions and iterating in iterative cycles. And IDS are going to help us develop a systems action research infrastructure. Data integration is around how do we better use the existing data that might sit in silos, but how do we better sort of integrate to get more holistic insights, as well as that's both quantitative but also qualitative insights. So, for example, a department or a team might do some insights with community members, but that's not necessarily shared across the system. So how do we share this knowledge so that both decision makers, practitioners could have more timely and better insights from communities sort of real time. Action and evaluation is about embedding more rigorous and better evaluation in all the work that we do. Quite often in public sector, we're so busy doing, we don't stop and reflect and learn if we're making an impact or difference. So that is a really important strand about evaluation and creating that evaluation system and a learning culture. Training capacity building is a program of work for our workforce at all levels, from some basic research concepts like how do we analyze data better, even things like confidence intervals. So we often interpret data, but they may not have statistical significance, but we presume that makes, so it's about interpreting data as well as sort of making that helps to make sense of it as part of our workforce development plans, but also more rigorous training opportunities as well, placements and secondments depending on the role. But the training capacity building is not only for council staff and senior leadership, particularly councillors as well, but also for community groups like the VCS. And we see that we want to really improve their capacity as well to do good research and evaluation. And the research partnerships work stream is around kind of especially our comms and dissemination and how do we nurture some of these. So examples, outputs, I've sort of mentioned a participatory action research infrastructure with communities. We want to co-produce an interactive data dashboard, hopefully at the 7 towns level, so that residents have more timely insights of local and holistic kind of local data. And with LSHTM, we'll be doing in year 1 a rigorous baseline assessment of how we currently use evidence, research, evaluation in the council to inform our plans going forward. And the overarching impacts, I guess, is better evidence informed policy and practice, greater research evidence creation, and greater learning from our we'll call it building blocks of health research collaboration for the bid. I think now at NHR, I think we're going to call it HDRC. I think that's the branding guidelines now. Next slide, please. So our impact, again, I can quickly go through this, but you've got it in your pack. So for different stakeholders. So by the end of the year 5, we'll start, and it's not just the HDRC programme that will help this, it's all the other things that are happening in the council and in the system to change the culture. But the HDRC will definitely contribute in a big way to this, for residents to experience a step change in the way the council works together and co-creates with them to bring about systemic change towards health equity. For the VCS, they benefit from the research capacity building process. They're able to use this to get more funding for their work. Council officers to benefit from this workforce development programme and have better skills in these concepts, including interpreting data. For senior decision makers, including you guys and SLT councillors, will benefit from bespoke training and capacity building so that they can champion the role of research evidence. So a success measure may be, how do we in certain reports, like cabinet reports and things, kind of demand good evidence for our decisions. And the academic collaborators obviously have a huge benefit to work with us. They want to be doing this kind of work, and they'll benefit from greater collaboration and generation of research outputs with us. Local partners, including Health and Wellbeing board members, will engage with, can benefit from some of the integrated data and access to certain bits of training. and the stakeholders outside Ealing could benefit from the new knowledge and learning created. And there's already a push to create learning networks with the current HDRC networks. There's a Pan-London network as well as a national network. They really want to share learning amongst the HDRCs and also with all our other networks, London councils, public health networks, etc. Next slide, please, Sam. So the focus for this year will be a lot of the sort of infrastructure building. So may not see immediate sort of, let's say, big things happening. So some of the boring stuff will have to happen in the first few months. So a lot of the partnership agreements, the boards being set up, reporting mechanisms, the financial ethical frameworks, develop performance reporting, the staff. So we have about 11 new posts in the bid. So some of those staff, including the program management. So Vijay, your point about coordination, we've got program and admin support for this work, as well as on the academic side. The costs for the academics include some sort of administrative costs that will help the coordination across 3 universities. The comms and the dissemination strategy. So we're very aware now also that we need to kind of speed that up because there's a bit of a gap obviously at the start. We want to communicate this well. It's a bit of a complex sort of thing to communicate because it's not an obvious immediate kind of research project, but it's a capacity building. So any help and suggestions around that would be helpful. But I think the baseline assessment project with London School of Hygiene would be really interesting, and we'll be engaging with some of you with that piece of work. And that will really, I think, be useful for the council to understand. I think that the use of evidence that will vary across directorates, but there'll be some overarching themes as well that will inform our work plans. Similarly, in workforce assessment about kind of what kind of training needs there might be. And then finally, that we will start to do some of the community action research thinking with community residents, systems mapping exercises in which we will start to think about our action research infrastructure, which will continue in the subsequent years. So quite a lot to get on with this year. I think that was the final slide. Links with the Health and Wellbeing Board. So we propose an annual update, but this is for discussion with you guys, whether you think that's fine or sufficient. For the Health and Wellbeing Board to have some oversight of the progress. We still need to finalise the final governance arrangements in the next few months, including the internal council governance. We've put some stuff in the bid. We just need to sort of finalise that around the SLT and the Cabinet Communities Board and Academic Advisory Panel that we've proposed as well. So that was my final slide, and just really want to open up for thoughts and suggestions and questions. Thank you.
Great, thank you, Vaishnav. I think Anna was just going to add a.
Oh, sorry, and I
also
wanted to bring in Gurpreet if I forgot to bring you in, Gurpreet. So if you also had anything to add.
Hi everyone, I'm Gurpreet Rana from Ealing and Hansa CVS. We're really excited by this new funding. We hope the funding will help VCS groups become more research active, especially enhancing the capacity of small groups that represent some of the underserved communities, deliver better quality services that effectively meet the needs of residents, supporting groups to deliver new activities that identify through research need, also helping VCS groups increase and improve their resource base. By using the research evidence, we can hopefully maximise external funding coming into the borough, and also greater collaboration and partnership. And we hope to achieve this through our voice network, so we can kind of co-produce services. So we have had a number of planning meetings with Vaishnav and the team, and we're looking forward to our away day on the 29th. So hopefully we can kind of get some more information of how this project's going to run.
Great, thank you very much. And welcome to the Health and Wellbeing Board. Anna.
Thanks, Chair, and thanks, Vaishnav, for talking us through all that. I think it's fantastic news, and just so pleased with got there. I think especially looking back to the strategy, it'll really kick us forward and move us further and faster than we'd otherwise be able to do, which is great, really takes us forward. And I think the strategy and the work we do across the partnership really helped us win that bid as well. I think it could show that local commitment and through the council plan as well in terms of working with communities in a different way and really focus out on inequalities. I think it really helped us, and quite a few people have said that our bid was quite different from other areas. I'm really interested to see what Ealing will do. I think just going back, Vijay, to your question about how we do this together, this is very much money for councils because we haven't got the research infrastructure that NHS trusts have and have had for a number of years. So I think in terms of the benefits, I think it makes the council more research ready, and this is really to set us up and get ourselves going. I think, like Gurpreet was saying, it really enables us to work jointly with community members to do that together and actually skill up an awful lot of organisations and individuals out there to do that with us, which I think really benefits that joint working for us. And I think with that focus on the building blocks of health is really different. Really pleased to see NHR kind of committing to that. So it's not us going out there and necessarily doing kind of health and care service research, although that would be part of it. It's much more looking at kind of the lives of residents and how we work with them on improving that and what would help. So I think for me, it puts us in a much better position to do that partnership work a lot more meaningfully, have a lot more capacity to do it, a lot more skills across the communities, and hopefully it'll set us up really well to do that as partners. We had to be very careful in the bid not to talk too much about partnership work because it was very much about councils, but it was kind of written in there every time we did it.
Great. Thank you, Anna. Would you come in on that, Vijay?
So in terms of the bid and the awards, I absolutely understand around the monies are here to pump prime and build that research infrastructure within the council and the council's partners. But there obviously becomes a point when you actually need to do some research to demonstrate some outcomes afterwards. So I presume within this 5-year program, at some stage within the council and your partners, you will then start to decide what areas of research you do want to then concentrate, so then you can start to develop some outcomes which could then be built on for future research.
Yeah, definitely. Vice, you able to come in on that one?
Yeah, I was going to say, sort of anticipate that as the years progress, the ability to start doing more research, and already the partners in our bid kind of have expertise, you know. So LSHTM really interested in kind of the built environment and housing, and you know, that they're ready and eager to do research, and we're having to sort of step back a bit to say we need to do the capacity building bit as well. But we do anticipate year on year that there might be more research done and people wanting to do research in Ealing, other institutes as well. So we do anticipate that actually one of our success measures is that there are, by year 5, academic outputs kind of generated. But we're also building into the process a annual research priority setting process, which is community led. So kind of some of the research priorities often at the moment are very top down, and the kind of the will of the academic, the interests of the academics kind of wanting to come into a community to research X, Y, Z. And we're really keen that the priorities of the residents of Ealing are also just kind of central to this.
Councillor Mason.
There's a very famous story in political world about Frank Dobson, the former health secretary, going canvassing in an estate in his constituency, as it was Holborn and St Pancras as it is now, and he took a person with him who is very known to sort of be, one might say, very interested in certain sort of international political affairs, and he sort of tell the story of that person being taken to the doorstep of a woman on a council estate in the constituency and being subjected to an expose of all manner of international affairs, and said a lady who lived on that council estate but said, that's all very well and good, thank you very much for that, but what are you going to do about the smell of pee in the lift? Mm-hmm. And it's a vignette of, I think, a really important principle that sits at the heart of the programme and what we've been trying to do, certainly since the new administration, which is to sort of reset a little bit. when I say a little bit, I say fundamentally reset the nature of the relationship between people and the powers and the authority that sits around them, to determine how we change their lives and how we make their lives a bit more happier, a bit healthier, a bit longer, and a bit more sustainable. And I think it's absolutely fantastic that 15 years on from the Marmot report, it might have taken a little bit long, but yes, we've sort of wrestled back, and I would say this with Nye, that we've wrestled back public health to local government, and we have a clear understanding of wider determinants and the building blocks of health, but that now biomedical research is giving way a bit too, and that actually we can turn the process on its head a bit. And in many senses, I think this is going to be quite groundbreaking, not just for Ealing, and I'm sure it's the case in other local authorities too. But, you know, we equally sort of trace to some extent our origin stories in administration to a bit of public experimentation, which was not really public sector experimentation. It didn't have baseline data, it didn't have a hypothesis. There weren't any really clear senses or understanding of what those interventions were, any sort of control measures. There certainly wasn't an evaluation, and there was no clear sort of sense as to where that evaluation would lead to a hypothesis for a new set of interventions. And therefore, sort of having that degree of inquisitiveness and working with communities to identify what they want to focus on to make their lives that bit happier, healthier, longer, and more sustainable is going to be really, really important. And I think it's going to be really quite exciting. It's going to be exciting for communities, but I think it's also going to be quite exciting for the organisation. You know, in all bits of the organisation, whether it's our highways team or whether it's our, you know, whether it is the public health team or whether it's our teams working with young people in care, the prospect that we're going to have a bit more resource to be able to think a bit more deeply about whether or not the solutions that we're drawing up are indeed shots in the dark that are going to make a difference, but are actually really well thought through and can inform the shape of how we develop public policy in sort of the modern age. So I'm really excited to get past this next year of governance and paperwork, and really, really excited to get out to talk to communities about what their priorities are and about the research that they can be co-opted and participating in to do the things that they want. So that, you know, in God bless him, Frank Dobson, who's no longer with us, would be fulfilled and happy and sustained knowing that that we are actually, yes, indeed, talking about the smell of pee in the lift, which to an awful lot of people is far more important sometimes than the priorities that we all, as politicians and as academics and as officers, decide are the ones that they should be interested in. So, you know, it's the first time I've been able to really speak on the public record about this. And I'm really, really, really absolutely fantastically pleased that we were able to win the bid. So well done and congratulations to all. And I'm really looking forward to see how this goes.
Thank you. Anna.
Thank you. I can't beat that, but I did want to add one positive note, just going back to VJ's question. I suppose, like with the health and wellbeing strategy, we're not starting from scratch with this. This is really just pushing us forward in a different way, in a much bigger scale and scope than we'd otherwise be able to do. I think the only thing I'd say is there is a lot of research already happening with our communities and by our communities. So, for example, Institute of Development Studies, who we mentioned, started working with us during COVID and started looking at the kind of vaccine hesitancy in different communities, including with young people, which has been great. It's now been working with some of our CVS organisations, with some of our groups, especially our Black African, Black Caribbean communities as well. So really good examples of where we've already got those links with academic partners, and they're already working really positively with our communities. So great, really looking forward to seeing where this gets us. I think we all want to get past the first few months of contracts, and Vice probably more than anybody else, but yeah, really, really excited to see where it goes. Thanks,
Anna, and to Vice and everyone who's involved. It was an arduous process, and I only saw a tiny slither of it from where I sat. So thank you very much to everyone, and it is a very exciting opportunity for us. £5 million of funding to improve it, you know, however we do it through the research to improve the lives of our residents. So thank you very much for your successes, and we look forward. I think an annual report sounds probably the right way forward. So we look forward to hearing at this forum how that is going. Speaking of the year ahead, work programme, Anna.
Yeah, thank you, Chair. Apologies. I think this got a bit messy over Christmas, so apologies. This isn't the neater version. So there's a lot of work coming up. I think March is a little bit on the quieter side. I think our carer strategy might be a little bit later than March. I think it might be June. We were just mentioning, Simon mentioned earlier about the annual updates, especially around the North West London Trust strategy and ICS. And I think, Simon, we can chat with you about when that's in, and especially with the health equity work, I think would be great to kind of see how that's going. We've also got a number of JSNAs going on, so we'll pin down the dates on those. But I think more fundamentally, there's work to be done under the strategy action plan around how the board works, what the membership looks like, how we engage more with communities, and especially around the kind of equalities, diversity, inclusion agenda. So I will tidy this up, and Sam and I will bring something clearer next time. Thanks.
Great, thank you. And we'll be in touch with partners offline for further items. We did have we had 3 questions, I think, from Roy. Roy, if it's okay with you, I'll ask Kerry to get back to you separately on the first one, which is a contractual one. But Roy, you did have a question around cost of living, and then a separate one on the consultation on palliative care services. So I don't know if you wanted to ask them both, and then Kerry and others can chip in as necessary.
Yes, indeed. Thank you. I'm Roy Willis, chairperson of the Social Care Campaign Group, and I want to wish everyone a happy, healthy and peaceful new year. And then I'll go straight to my questions. ESGAG campaigns against social care charging as a policy, but in the meantime, cost of living crisis and rising household bills has meant that some Ealing residents are facing increasing difficulties with those social care charges. And I just wanted to know, is there a protocol in place to allow time to investigate individual circumstances or to review the care package? How do finance and social care staff work together with service users and carers to resolve these complex situations involving benefits, savings, and their attitude to paying these bills, these social care charges? And I wanted to know how the council does this without overreacting to situations or resorting to legal action. So that's the first question. And the second one, I know we're probably late to the game about asking questions about the consultation on palliative care, but really I think we wanted to know how is Ealing Council or the Health and Wellbeing Board specifically engaging with the ongoing consultations on the future shape of palliative care services, and could the Northwest ICB provide us with a guide on the most up-to-date proposals, because I think it's fair to say it is very confusing at the moment. There are six options, some of them with or without the Pembridge hospice beds. So really, that's what we're asking today. Thank you.
Thanks, Roy. Kerry, did you want to pick up those and the palliative care from the council's point of view as well?
Yeah, thank you very much. Thank you for your question, Roy. In terms of the palliative care engagement and consultation strategy, I think it would be useful, but it's the chair's discretion to bring a paper here or for further discussion with North West London to get a position on that. But I think it's a helpful issue to raise. In terms of the charging policy within the council and how the adult social care team works with the financial department within the council, from under our Care Act duties, we review cases on a regular basis in terms of the package of care to support individuals and to support their levels of independence, but also to ensure that packages continually meet their eligible needs under the Care Act. There are also reviews that are completed on an annual basis in terms of changes to people's financial situation. If somebody's financial position changes in year, then they can certainly contact the finance department to obtain a further financial assessment update to reflect those changes. The finance and the social care teams, while sitting in different areas of the council, work very closely together on a regular basis with regard to general oversight of management of debt, but also in terms of understanding complex situations. The council takes all steps to resolve situations where possible before proceeding to any legal interventions. We're very conscious of the impact of the cost of living crisis and the challenges that people who use our services and that carers in Ealing face, and the disability related expenditure disregard in Ealing continues to be one of the most generous in all of London. So I think there are some significant actions and support that are provided, but to provide you assurance that the social services and the finance teams work closely together in terms of managing our response to people in financial difficulties. Thank you, Roy.
Thanks, Kerry.
Okay, thank you.
Great. So I think an item on the palliative care conversation would be really helpful. I don't know if Neha, if you got anything to add right now, that not to put you in the spot, but
no, I was obviously I didn't have this question in advance, otherwise I would have had a bit more of a response prepared. But there is a piece of work happening, and there've been a number of events where public have been, and different members of the public have been invited to various meetings to discuss the various options that have been considered following a lot of co-production. Meadow House is our local provision, and we're in fact doing some work with them to just look at what the options are, what the current provision is, what the pressures are, and what we can do better as a partnership to help support them to improve the services and support them as well. I'm not sure if Simon wants to come in with anything else, but we're starting some conversations with them as well, and we would like to set up a group. So happy to ask the lead to come and bring a paper here if helpful at this stage, or maybe slightly later on down the pathway.
I think let's have that conversation offline as to when the appropriate time would be, but I think it would be a really helpful paper to take on that. So Roy, there will be further news at the Health and Wellbeing Board. Simon, you've unmuted. Did you want to add anything at this stage?
Not hugely at this stage. It's early days of the review. We've been undertaking at Meadow House. We've been doing that predominantly internally with people who use it, but it's also about how the service works with the rest of Ealing Hospital as well, and the support it gets as well, just in terms of resilience of the service and pathways in and out. But very happy to include an update at the same time as the broader update around palliative care comes at a future meeting.
Great, that'd be really helpful. And a final word from Vijay.
Yeah, just following on what Neha says. So North West London ICS has done a review looking at the community specialist palliative care services across the entire North West London area. And you know what we have put together is what we feel is a consistent offer for all residents in North West London. There are some gaps in the services currently. Even locally, there are gaps in terms of what currently Meadow House can offer, and that's partly related to difficulties, particularly in relation to workforce, and hence, you know, we are working with Meadow House, and we are soon to meet them to try and work out how we can support Meadow House in terms of providing that consistent offer, which is what we have agreed across North West London for all our community specialist palliative care services. But it is work in progress, and as Anna said, we will be able to bring an update in the future.
Great, that would be really helpful. Thank you all very much for your time this evening. Those to online as well, thank you very much for dialing in. I think the date of the next meeting is the 20th of March, and we will see you there. Thank you very much.